one. So I'm going to introduce Wyn Garnett, who is the program lead for embedding the voluntary and community sector in the integrated care system. So over to you, Wyn.
Thanks, Lee. Good morning, everybody. And thanks for joining me this morning, especially because I'm aware it's the half-term break and a lot of people are away. So a big thank you for taking the time this morning. As Lee said, my name's Wyn Garnett. I'm the programme lead for a programme that's called Embedding the Voluntary Community and Social Enterprise Sector in the Integrated Care System. A bit of a mouthful, but essentially what it's about is looking at how voluntary and community groups can best be involved in the new integrated care system. It's a national programme, so that's happening in each of the systems across the country, and I'm working on the Derbyshire aspect. I'm self-employed. I'm based within the voluntary and community sector, so I'm not based within health or local authorities. I'm working independently, so I'm coming from that perspective. I thought what might be useful before I kicked off, I've got a bit of background noise that disappeared now. Yeah, that's great. I thought what might be helpful would be just to give you a bit of background to me. I mean, I've spent about 35 years in the voluntary community and social enterprise sector. So I started off working for a council for voluntary service, worked as the chief executive there, and also in a regional infrastructure organisation in the East Midlands, bringing voluntary and community groups together across the East Midlands. And for the last 14 years, I've been working as an independent consultant and doing a lot of work for the Lloyds Bank Foundation. And last year ran their COVID support programme in the East Midlands. I've also spent a lot of time as a trustee, as a chair, and as a volunteer. So hopefully that gives me quite a broad perspective on the sorts of challenges and issues that voluntary groups are facing and what we might be able to do to help around those. And I've seen voluntary groups do the most extraordinary things. I worked with the sector in Nottinghamshire during the pit closure programme and experienced how the sector met some of the challenges that communities were facing there. I've worked with organisations during the recent pandemic. And the flexibility and impact that organisations have is quite extraordinary, I think. So for me, one of the things that I hope to bring to this is a passion about what the sector can actually contribute to some of the issues that health and social care are looking at. Now, just to give a little bit of background to what I'm going to do this morning, what I'm going to talk about is how I think the voluntary community and social enterprise sector might fit in with this new integrated care system. I'm also going to talk a little bit about some of the challenges that brings. Won't catch them all, but talk about some of them and also how we might address those. Now, in doing that, just a couple of provisos. First of all, I'm aware that on the call this morning, there will be varying degrees of knowledge about the integrated care system and what voluntary and community groups are doing. And I guess I'm just going to scratch the surface of many of these issues. So as Lee says, if you want to stop me at any point, or if something isn't clear, or you want more information about something, please do put a hand up. And I think Lee will be keeping an eye on that and can alert me to that. And if there's anything that you want to drill into in a lot more detail, then when we finish the presentation, quite happy to do that through the question and answer session. And I know that there are one or two colleagues on the call today who've been involved in some of the work I'm doing, who may also be able to help and may also be able to chip in. So a few provisos there. One other just bit of a health warning about what I'm going to be talking about. The new integrated care system actually isn't in operation yet. I mean, the work's taking place at the moment to put that in place. And some of you may know that the timescales have slipped back a little bit on that. So, for example, the statutory part of the system, the Integrated Care Board, is now not going to start until the beginning of July. And in other parts of the system, up until around September, there's work taking place to look at how things will work and what the functions are going to be and what the structures might be. So that means in terms of the presentation I'm going to give, to some degree, there might not always be answers to the questions you've got, and there may not necessarily be things sorted out yet. What I may talk about more are some of the challenges and work we're doing in preparation for that. So, for example, if you're hoping today to find out where you can get funding in the new integrated care system, then that's probably a question I'm not going to be able to answer at the moment. But what I might be able to do is give you a broader sense of what that looks like. So that's what I'm going to do this morning, and I'm now going to reach that terrifying stage. I'm going to try and screen share and hope my presentation appears on screen. So let me see if I can do that. See if we can do this. Has that?
I can see them both here. That win, brilliant.
Oh, brilliant! So I'm just going to put it on to play from start.
That'd be great. Yeah.
Is that great? Is that working for everybody?
It is for me.
Yeah, brilliant. Okay.
Lots of nodding heads. Yeah.
Okay, so I know that a number of you will have been on previous Derbyshire Dialogue sessions where people have talked about the integrated care system and what it looks like, and the roles of different parts of the structure. So what I didn't want to do this morning was to duplicate that and go through all that again. Happy to kind of clarify some things if that isn't clear. Oh, sorry, that's okay. Just looking at a message there about some network issues somebody's got. But in terms of just headlines, the drivers behind the integrated care system, the thinking behind it, is that it's designed to bring organisations closer together to plan and deliver social and health care. So the whole thrust of the integrated care system is to try to encourage collaborative working and joint working between voluntary community and social enterprise organisations, health organisations, local authorities and other partners, just to make joint working more effective. And I think one of the interesting things for us as a sector is that the guidance takes a much wider view of health. So it's not necessarily just looking at health in terms of being an illness service, but it's looking at how health can be a wellness service. And it talks about how important it is to tackle health inequalities and determinants of ill health. So the things that actually lead to people becoming ill and having to access the system, what we might be able to do in a more preventative way to reduce demands on the health service. And that's probably something really interesting for us as a sector, because a lot of the work that voluntary and community organisations do is actually dealing with a lot of those things. It deals with inequalities, it deals with some of the things that can lead to poor health. The other thing that comes through very strongly in the national guidance about this integrated care system is the desire to do things differently. Now, I know one of the anxieties that people do have is this just a rearranging deck chairs on the Titanic? And I don't think this is. I mean, the guidance is very clear that what it wants to do here is to do things in a very different way. And for example, around funding, to try and move away from a commissioning approach and start to move more towards a collaborative approach. And that's quite interesting again for us as a sector, because one of the things that I've picked up in the discussions I've had is that people feel in the past the relationship between voluntary organisations and the system, between health and social care, has been a kind of parent-child relationship where voluntary organisations are a provider, they're delivering services that somebody else has sorted out. And I think the intention behind this is to try to change that relationship and make it more of an equal one, so that we're more involved in all aspects of the system. So we're involved in planning, we're involved in priority setting, we're involved in design as well as delivery. And the final thing that comes through in the integrated care system guidance is this phrase it uses called subsidiarity, which means pushing things down to the most local level possible. And what it talks about is trying to ensure that local needs and local perceptions actually shape the way that services are designed. So there's some very some very positive things, I think, in the national guidance. I mean, obviously, the real test of this is putting it into practice and whether we can actually see this happen as we move forward. And in doing those things, the integrated care system guidance says some particular things about the voluntary community and social enterprise sector. So it sees it as a key strategic partner with an important contribution to make in shaping, improving and delivering services. So as I say there, what it's saying is we should be involved in all aspects of the planning and delivery of health and social care services. And even more than that, what it says is we should be embedded in all parts of the new structure and system. So that the system should make sure that we're really engaged in all aspects of the work. So that's a bit about the integrated care system. What about the voluntary community and social enterprise sector in Derbyshire? Well, we could talk for ages around this, but I was just going to give you a bit of a snapshot around this. If we look at the left panel, I mean, many on this call will know this better than I, but voluntary community and social enterprise organisations are active in just every area of life that you can think of. We're active around health issues, we're active in social care, we're active in sports, arts, faith, and also organisations are drilling down into communities of place, so working in very small communities to address issues, and also communities of interest where people provide mutual support and have common conditions or have particular communities that they identify with themselves. So active in every area you could possibly think of, and also of all sizes, I think, all types of sizes of organisations. Oh, sorry, what's happened there? Had a bit of a malfunction there. Lee, is that me, or is it something that's happened on the call?
No, if you just try sharing your screen again.
Right. Are we back?
Yeah, it's picked it back up from that slide. So if you're able to go onto the full view for the slide again, that'd be great, and we'll carry on.
Let's have a look. There we go. Yeah, don't you just love technology?
When it works.
Yeah, and you're now getting a quick preview of the rest of the slides, so even more impressive. Okay, so let me find that slide that we're on. Okay, back to that. So we've got organisations of all sizes, so people will be aware that we've got large national VCSE organisations with turnovers of millions. Some of those nationals have local branches. We've got local branches of nationals that are affiliated, people like Citizens Advice. We've got smaller county-based organisations like the Derbyshire Carers, like Derbyshire Autism Services, who work across the county but aren't national organisations. And we've got very small volunteer-led organisations. I mean, most of the organisations that exist in the sector have no paid staff at all. That they're volunteer-led and operated and run by volunteers. And we've got organisations that are advocating with lived experience, which engage people who have experience of using services and provide that perspective. And we have a huge range of functions that voluntary and community organisations are undertaking. So we've got organisations providing direct services, both across the county and in local areas, thinking of things like befriending, transport schemes, those sorts of things. We've got organisations that are advocating on behalf of particular communities, putting their point of view, trying to shape the way services are provided. We've got campaigning organisations campaigning on particular issues. We've got infrastructure organisations that are set up to support the sector as a whole. So organisations like Councils for Voluntary Service, and we've got organisations providing mutual support, so people who are organisations where people come together to provide each other with mutual support, either around conditions or also within communities. And I think in that sort of description, one of the real explosions that we've seen in the sector over the past couple of years is around the pandemic, where we've seen an absolute explosion in mutual support organisations working in communities to support isolated individuals, to help with things like shopping and contact and prescription provision, that sort of thing. So seen a huge increase in that. And also other opportunities that have started to appear. So some people may be familiar with the concept of social prescribing, where GPs are starting to prescribe contact with particular organisations that may be able to provide support to individuals. So a very, very wide range of functions that organisations are undertaking. And I think the interesting thing in the sector as well is it's not even that clear cut, because sometimes organisations are providing 2 or 3 of that functions at the same time. So that makes it even more complex. Now, in the right-hand panel, we don't have any absolutely up-to-date information about the voluntary and community and social enterprise sector in Derbyshire. The last significant survey that was done was in 2011, and that looked at the county of Derbyshire, but didn't include the city. So these figures are going to be much bigger when we look across the system as a whole. So that study suggested 5,000 organisations, 5.5 million service users, a combined value of £340 million, 10,000 full-time equivalent paid staff, 6,000 full-time equivalent volunteers, and 70% of those organisations being composed only of volunteers. So even those are a little out of date in terms of figures, they do give a sense, and I think what they give a sense of is a very, very significant sector, and a sector that has a major role to play, I think, with other partners. And just to give you a sense of that, when we look at the fourth one down, 10,000 full-time equivalent paid staff, I mean, that's around the same number of staff that the Derby Royal employ. So that gives you a bit of a sense of the nature of the contribution the sector are making. So what can we bring to the table? Well, this is just a few of the things that I think we can bring to health and social care planning. I think we're very good at bringing new approaches, different ways of doing things, approaches that complement the way that statutory services are provided. So we bring a very fresh and different approach, and a way of looking at things differently. And I think sometimes some real flexibility. I mean, we saw in the pandemic how organisations were able to be flexible and responsive very, very quickly to new demands and new challenges. And I think that's something that we can make much more of. I think what we can also do is provide a reach into an engagement of particular communities. So if we think of the way that health services are provided and some of the data that exists about trying to identify particular priorities, I think what we can do is help to look at those and put them through the prism of very particular communities. So whether it's a particular part of Derbyshire, whether it's somewhere like Normanton, and drilling into that and saying, what do these issues mean for your community? How do you see those? What would make a difference to you as an individual? What are the particular issues we can work together on to improve? Or whether it's communities such as black and minority ethnic communities, travellers, refugees, asylum seekers, how those sorts of communities have their own particular challenges around healthcare and particular needs in terms of support. So I think we can be very, very good at helping statutory organisations reach into those communities and start to address some of those issues. The third point I put was about being cost effective and value for money, and I don't think this is about being cheap, because some people say, oh, the voluntary sector is a cheap option. This is about using resources effectively and providing value for money, and we're very, very good at doing that in the sector, through the engagement of volunteers, but also in our ability to attract funding from other sources. And just to give you an example, I know there was a study done in 2011 in Derbyshire around befriending, and that suggested that for an £800,000 investment across the county in befriending in the voluntary and community sector, it actually generated £7 million worth of value. So those sort of things just demonstrate that the degree of value that we can bring as a sector. And I think all those things in terms of the system will lead to better informed planning of services. If people hear what different communities want and drill into communities and listen to them, it's going to lead to better services. We're going to see better preventative work, which will lead to a reduction in costly later interventions. So if we can do work earlier on with people, then hopefully what we're going to see is a reduction in the people who just end up with much later healthcare interventions that cost a lot more money. Better use of resources, and a contribution to some of the key challenges that the system's facing at the moment in areas such as discharge, helping people to stay and live in their own homes, how we recover from COVID, those sorts of issues. So that all sounds great, but what are the challenges to doing that? What are some of the real challenges we face as a sector in achieving that? Well, firstly, if we think back to that earlier slide, 5,000 organisations plus all the ones in the city, that's an awful lot of organisations to get round a table. And one of our real challenges is how do we engage such a large and diverse range of organisations into a structure that's quite rigid, that's got bits and parts to it and works in particular ways. So that's a real challenge for us, I think. And I think part of that is also about how do we engage organisations that might not necessarily be health specific. So there are organisations dealing with, I mean, I mentioned refugees and asylum seekers, but it might be issues like domestic violence, or it might be advice around debt. All those organisations have a contribution to make towards health, but aren't necessarily health specific and might not have been necessarily considered in terms of involvement in the past. So how do we engage all those types of organisations? And part of that challenge is how do we make the right connections? So if there are all these different parts of the system working at different levels, how as you as an organisation, how do you make the right connection that's going to work for you and for the people that you work with? So that's a real challenge. And capacity just to do everything. I mean, capacity to be involved in this structure, capacity to support people who are involved in the structure, and capacity to do things. So, for example, one of the issues that I've been picking up around social prescribing is that although referrals are made to voluntary and community organisations to provide services as part of social prescribing, there's no funding to support that. So we do clearly have issues around capacity. The other issue I picked up from the beginning, which I think we've done a lot about, is the level of understanding and awareness of just what the voluntary and community and social enterprise sector is, what it does and what it can offer. Now, this isn't meant as a criticism, because it is a complex sector to get to grips with it. And I know that within the statutory sector, there are a variety of levels of understanding about what the sector is, and that's often driven by people's personal experience or the organisations they work with. We're addressing, I think one of the challenges we've got is how do we improve people's understanding of what the sector is. And also for us, I think, how we better understand the system, how that works and where our contact points are, where we can contribute, what our offer is. So some work around that. In terms of culture, I mentioned this new system is very much around doing things differently and trying to get people to work together. And that's a bit of a shift, I think. And I mentioned about this real partnership as opposed to the kind of parent-child relationship. And that's a shift in a cultural way of working. So there's a challenge there in getting people to think differently about how they work with us and how we work with each other. Resources is also always an issue for us in the voluntary community and social enterprise sector. I don't think it's just about lack of money. Sometimes it's around security and sustainability of funding. So having to manage on funding from year to year or month to month, which makes it very difficult to plan and work ahead. how we manage to engage and support small organisations, because I think in the past the kind of procurement and commissioning processes have been very difficult for smaller organisations to engage with, and have almost excluded them from being part of the process. So how can we look at that? How do we address issues like social prescribing to make sure that organisations that the system does want to deliver services are getting support to be able to do that? And how we address some of the barriers that exist to joint working. So perceptions around quality. I mean, sometimes you hear people saying, well, I don't quite know what the quality is of that service that organisation is offering. I'm not sure whether I'm prepared to take that level of risk, and this whole risk aversion thing. Well, I think that's something that we can work with. I mean, there are some exceptionally high quality services in the sector, and our ability to promote those, to make sure we've got consistent quality, to encourage people to take risks, but also to look at issues around data sharing, which can get in the way, where it's very difficult to share data about people across partners. So a number of challenges there. This one is, look, I mean, this is one of the more simple versions I've seen of the structure and where we might fit into. If we look at the blue boxes, the blue boxes are the kind of structures that exist in the integrated care system at the moment. So you'll see on the right hand side of the slide, you've got the geographical part of the system. So we've got the Integrated Care Board, which begins from the beginning of July, and the Integrated Care Board is the legal part of the system. That's the statutory part of the system, and that will be the body that replaces the current clinical commissioning groups. And alongside that, working across the system and the whole county, we've got something called an integrated care partnership. And the integrated care partnership is the one that's going to bring partners together to develop the plan across the whole county and across the whole system. Now, feeding into that, we've got two place partnerships. They call them place partnerships. Again, these involve all partners, and one is focused on the city and one is focused on the rest of the county. They're going to take information from local areas. They're going to be involved in looking at how services are best provided. They may have a role to play in investing in the VCSE sector, and they'll be looking at how to make that system-wide plan a reality. And then we've got the 8 place alliance partnerships. Those are based and coterminous with current borough and district council boundaries pretty much. The exception perhaps is the city, where the city is both a place alliance and a city place partnership. It covers both of those. And those are going to be really important because those partnerships will engage directly with communities. They're going to be the ones that are engaging with GP networks. They're going to be the ones that are engaging with issues like social prescribing. And the intention there is that the information gathered from those place alliances are going to influence the work of both the place partnerships and the integrated care partnership. And if that wasn't complicated enough, on the left-hand side, you'll see in the blue box, we've got a number of delivery boards, and those delivery boards are working right across the system. So they're working across the whole county, and they're working on those 4 areas. So we've got a large one, which I think will be of interest to a lot of voluntary community and social enterprise organisations, which is looking at mental health, learning disabilities, autism, children and young people. And that's just established an alliance to bring organisations together. We've got an urgent and emergency care delivery board. We've got a planned care delivery board, and I think there's some work taking place to look at setting up one around primary community care. Now, at the moment, in terms of VCSE sector input, there's a lot of work going on around engagement in the mental health and learning disabilities, autism, children, young people one, less so in the other 3. In the middle, you'll see that we've got some, and I'm partially colourblind, but they look slightly pink to me, boxes, and a lighter blue box, which is around front. The lighter blue box is frontline VCS groups. So those are all the organisations that exist in the sector, the 5,000 plus organisations that we're talking about. Now, the way that this is starting to fit together from a voluntary community and social enterprise perspective is those frontline organisations very often will feed into local infrastructure bodies such as Councils for Voluntary Service or Derbyshire Voluntary Action, those sorts of bodies. And those bodies are very involved in the 8-place alliance partnerships. So for many organisations, that may well be the important connection to make with the place alliance partnerships and with local VCSE infrastructure organisations. However, it's also open to any organisation to join something called a VCSE Alliance, which is a new grouping that was put together just before Christmas, that's open to any infrastructure, voluntary community sector, social enterprise infrastructure organisation, but also to any frontline organisation. And that grouping is where we're trying to get to grips across the system. So that's where we're trying to get to grips with engagement with the Integrated Care Partnership, the Care Board, the City and County Place Partnerships and the Delivery Boards. So if you're interested in being involved in that, then you're very, very welcome to join it. It's not an either or. It just gives people another way of getting engaged with this. Those local infrastructure organisations I mentioned also come together across the system and the county in something called 3D, which is where they meet to take a system and county perspective and think about how they work best together. And 3D, all 3D members are part of the VCS Alliance. And then we have other networks that exist across the sector. I've just mentioned there the VCSE mental health one, which helps to feed into the delivery board around mental health, learning disabilities, autism children and young people. So I apologise for the complexity of that, because I think it is a complicated structure, and if anything this tries to simplify it. There are so many different levels to it, and that in itself generates a number of challenges for us. So moving on to actions, just very quickly to talk to some of the things that are taking place at the moment. I mentioned some issues around engagement. You'll notice from that diagram we've just looked at how complex the system is. So how can we possibly engage such a diverse sector with such a complex structure? So one of the ways we're doing it is the development of this Voluntary Community and Social Enterprise Alliance. So as I say, information goes out around that through local infrastructure, through the Joined Up Care Derbyshire newsletter. But if people want to join directly, very happy for that to happen. Just let me know. There is a process about to kick off called the Icb Agreement. Now that process is about how do we put down on paper how the voluntary community and social enterprise sector is going to be involved in this structure, so that it's down there, it's enshrined, and it's something we're all working with. Now, the VCS Alliance are just starting a piece of work to do that, which will be completed by July. And we're going to be doing a lot of consultation work around that. So initially, we're going to be asking for ideas as to what should be in that. And then once we've had those back, we'll be putting some suggestions together and then sharing them with a wider audience with something that's more solid to get feedback on that as well. We've got engagement challenges around staff resources in just the people who are able to make all this happen. So people like myself are a little bit thin on the ground in terms of helping such a diverse sector to engage in this. Just finding people to be involved in all these different bits of the structure is a challenge in itself. And one of the things that we're looking to do is to try and develop a pool of people who we can draw on to be engaged in all of these things. Now, there will be an expectation from around the amount of time people can give, the level of skills and experience that people might have, an understanding of the sector. But equally, what we want to do is to provide development support for people. So training, some support for meetings, support around mechanisms to help those individuals talk to each other and also talk to wider organisations. And Lee is actually working with me at the moment to develop a virtual VCSE platform that'll be one way in which it will help us link those people together and link people to a wider audience. And then there's a lot of work happening around community engagement as well, which is looking at how do we really effectively engage communities. And that's an interesting one, because the VCSE sector, I think, is one way of engaging communities, but there's work alongside that around how to engage patients, how to engage lived experience, so different aspects of community engagement, and we're part of that process. There are a lot of programs taking place at the moment around trying to bring people in the sector together with people from other sectors to try to build understanding and learning around the VCSE sector and what it brings. And I mentioned some of the other barriers around funding and data. Excuse me. We're just about to pull together a data discussion group to look at some of those data issues and how we might address those. And we also have I'm also working with people within the current CCG around funding to see how we might address some of those funding challenges. And you'll see at the bottom there, we've got a funding group. We're looking at new approaches, and we're also about to start with a group on social prescribing. So those are some of the actions we're taking. Just finish off with what might all this look like, because I think one of the challenges is people say some very positive and warm things about VCSE involvement, but what will this actually mean in practice if it works? Well, these are just some ideas. I think it should mean more involvement of the sector in service design and planning, and not just delivery. I think it should mean that plans and priorities reflect VCSE perspectives better than they have done. I'm hoping it'll mean increased engagement of communities of place and interest in that planning, and we can see evidence of that in the shaping of services. And we see that we're involved in all parts of that complex system that I've looked at. I think it'd be great to see more sustainable investment in the sector, so that might not necessarily mean more funding or new funding, although I'd like to see more consideration of how we might access mainstream budget, so that the issue about how we might deliver services that other people are currently delivering. I think it might mean that we're clearer about where and how we can contribute, so we know how to make those connections, that we see better partnership working, that there's more support in place to help effective engagement, and some of those data sharing issues disappear. So that's a rush through a very complex subject, and apologies that I've gone through it so quickly. I'd be very happy to take questions or address some of the issues that are contained in the question in the chat boxes.
Well, thank you very much for that, Wyn. I'd seen the slide deck, and as you recognised at the start, we've got we've had over 80 people on this call, so we'll all have different levels of understanding of the integrated care system. Not least myself doesn't quite know how it all works or is going to work in relation to the voluntary sector or other parts, but this is very much part of the process. So thank you very much for that. I think that was really explained as best as it possibly could have been. So I'm going to start from the top in the chat box and possibly put some impossible questions to you to answer, and feel free to ask me to jump in. But just so that everybody on the caller is aware, if there are things we can't answer at the moment, then we will take them away and try and get an answer back to you, and we can feed that back along with the slides and the recording of this session itself. So as we always say with Dialogue, it's a two-way conversation. We're not just here to tell you things, we're here to make it a conversation. So I'm just starting with Valerie. Valerie's comment about, does this collaborative approach mean that compulsory tendering will end?
Yeah, that's a really interesting question, and unfortunately, the answer to that is I don't know. I mean, I know that the desire is to use that as an approach less than has been the case. Talking to some of the people involved in the system, there is this dilemma of where there are existing good relationships and things working well. People don't want to throw things out of the bathwater and do things completely differently. But at the same time, I think there's a recognition that there are a lot of organisations out there that haven't necessarily been part of this process up until now. So it's how do we start to deal with some of those things. I mean, I think that the difficulty with compulsory competitive tendering is that it can be quite exclusive in terms of the nature of the process and the demands that are set within it, and some of the conditions that people have to meet in order to be able to be part of that. So I think some of that may depend on the nature of the service, because I know one of the things I'm very keen on is to try to ensure that we're better able to have mechanisms to fund smaller organisations who haven't been able to be part of procurement and commissioning exercises because the contracts have just got too big, too large and too exclusive.
Brilliant. Thank you very much for that, Win. And I'm just moving across to the next question from Colin. Does the VCSE and integrated care system receive adequate long-term funding to function efficiently? I can see that's going to be a very again nuanced / tricky one to answer.
Well, I mean, I can't speak on behalf of the integrated care system. I mean, Lee and other colleagues will be better able to talk about the funding that's going into the system to address those issues. In relation to VCSE sector, I think the answer to that probably is presently no. I mean, I think in terms of it's one of the challenges that we've identified is that the capacity to engage with the system is probably a kind word is to say stretched, but it's a real issue to make sure we can engage in the way that we'd like to engage. And I mentioned sustainability. One of the issues I perhaps should have mentioned at the beginning is my role only carries on until April 2023. So, you know, once my role comes to an end, that's going to leave a bit of a gap. So one of the things that I'm working with partners on is on legacy planning. So how do we ensure that some of the advances that we make at the moment are going to be able to carry on beyond March 2023? So yeah, I think we need to look at issues of investment, and to be fair, I think partners recognise that, because I think there's a recognition this is about a different way of working. I think around the sector itself there are capacity issues. I mean, I mentioned social prescribing. It doesn't seem fair to me that organisations should be getting social prescribing referrals and no resources to actually deliver the service. So, you know, you look at an area like that, and that seems to me to be something that just doesn't seem right, to be honest. So there are areas like that that I think we need to address. And as I say, it may not necessarily be about the amount of funding, it may be around the nature of the funding. So I think organisations need time in order to be able to plan and deal with things at a distance ahead.
Thanks, Win. And just to come in on the funding part for the integrated care system, looking at that as a whole, obviously we're focusing on the VCSE angle today. There is a lot of guidance that's been coming down nationally, and Win referred to that at the start of his presentation with regards to the VCSE, so about being more community-based and things like that, and that is the premise of stuff. But with the integrated care partnership, for example, which is a subsidiary of the wider integrated care system, without wanting to confuse things too much, there's still a lot to be worked out, and a lot of that will be dependent on guidance. As Win said, I think these challenges have been acknowledged by people within the system, certainly my colleagues, but to give a specific, this is, there will be something adequately funded long term. That is obviously that's the plan, but we shall see how it transpires. I'm just moving on to Anne's comment. During the pandemic, the availability of volunteers was very patchy. Does that mean the services you are talking about are dependent on where you live?
Yeah, that's a really good question. I mean, I think there certainly is an issue about consistency and quality of provision across the county, and it's I mean, I think that's a double-edged sword, isn't it? Because what you want is for things to be responsive and to reflect the communities in which people live. So the way services are provided in a very rural area are going to be very different to the way services might be provided in the city, and you want that to be different. At the same time, you want a certain degree of consistency and quality, I think, around service. So if you're living in any of those areas, I think it's probably fair to say somebody should have a right to say, I should be able to access the same quality of service wherever I live. So it's how you balance those two things. I mean, the nature of volunteering is an interesting one, because it's driven by demographics, it's driven by populations in different areas. We've seen a huge move during the pandemic to delivering much more online, so that's changed some of the demographics of volunteering. We've got people who previously might not have volunteered but are happy to volunteer online and do things online. So it's a very sort of fluid situation we're looking at, but I do think there are variations across the county in services that are provided.
Brilliant, thank you very much. And I'm just now going to flick to some of the hands that we've got raised. I will come back to the questions, the comments in the chat box, but it just helps me keep in line with myself, hopping between the two. So I've got I forget if it's the top one, but I've got three. So I'm going to bring Christopher in here. Christopher PNR. That's the correct pronunciation of the surname. You're on mute, Christopher.
Thank you. So it was just part of, it links to what Wynn's been saying on main contracts, etc., and the discussions in the chat. So it's clear that from a large-scale organisations already deliver. Okay, and there are a lot of them in Derbyshire. In fact, it's interesting when you talk to Nottinghamshire colleagues, Derbyshire is the envy of certainly in particular services, like autism and others. Because Derbyshire has more advanced VCS sector organisations delivering across various things like eating disorders, etc. So so there's something about preserving those local assets and using them to stretch, support and irrigate. Not just the big organizations that are delivering, but also the many others that provide brilliant support, like the VCSs and others, and bringing that together to release all the micro and other organizations who want to take part and want to go. Now, all of us have been in there lobbying on these initiatives to try and get more accessible tendering, for example, and it's been incredible to see the responsiveness over the last year and a half. So it's up to all of us to influence how we think those models should look. We must create them so that they suit the micro people and the large and the middle. But I think just being careful not to, it can be, we look, say, well, the bigger ones taking all the money, for example. And then also the small ones people will say don't have the capacity. Well, none of those are right in themselves. That's how we work together across those sizes, all following the same principle, which is to release anybody who wants to provide support. And then we work together all to do that. But just don't squash what's already there, sort of build on what's there. And if necessary, that can disappear, in time for example, like ourselves, we're happy to disappear if the service is being delivered really well. We'll focus on something else. There'll always be plenty to do. But the tendency is just to squash one and start the other. I've always seen this, and it's everywhere. So let's avoid that and let's work together, because we can create exactly what everyone wants. There's no reason why we can't. Thanks.
Brilliant, thank you very much. And I think something we'll all agree with there, Christopher. Valerie, I'm going to bring you in next.
Thank you very much, Lee. Most interesting. Thanks very much. A lot clearer in many ways, but in other ways, my mind is just completely blown. As I put on the chat, you've mentioned the new structures, but they're going to be on top of existing structures, aren't they? The trusts, GP practices, local authority structures, and so they've all got to be fitted in as well as the voluntary sector. And I just don't know how it's going to work, and I just wonder whether this is a precursor of doing away with some of those structures. I mean, will we see GP practices in the way we've got them now in 10 years' time? Will we see the trusts? Will we see them operating in the same way? I mean, are there any straws in the wind that you could perhaps, tell us about how the new architecture, I think you professionals call it, will impact on the existing architecture?
Yeah, that's another really tough question, isn't it? I think the intention with the integrated care system is to try to bring a lot of those bodies that you talked about together. So, for example, when we talk about the trusts, I mentioned about delivery boards. There's a delivery board around, urgent and emergency care. There's a delivery board about mental health services, which the trusts are heavily involved in. So the trusts will be involved in those processes, and some of the existing structures like the CCG will disappear. I think there's still some work to do on this, which is why at the beginning I said that this has been put back and there's still some discussions to take place. So, for example, for those of you familiar with it, one of the things that I think is a bit unclear at the moment is where the system-wide integrated care partnership fits with the health and wellbeing boards, because there does seem to be a degree of overlap between the two of them, and I suspect some of the reasons it's been put back is to have some of those discussions to see how those things fit together, and whether there's a need to have all of this. I mean, certainly from our perspective, we were having a discussion in our VCSE Alliance meeting the other day, and we're saying from a voluntary sector perspective, just trying to field people and engage with all of this is enormously challenging, because, as you say, it's not just this system. I mean, people are engaging with lots of other statutory partnership initiatives as well. So it is a challenge trying to keep pace with all of this.
Thank you.
Yeah, and just to second that, it's massive. And going back to the start of Wynn's presentation, when it was talking about stopping people getting ill in the first place, rather than the kind of reactive, let's treat them when they do get ill, that gets into the factors of housing, education, all those sorts of things.
Yeah.
There's so much to be worked out, and it is complex. Even if you did it in its most simple format, it'd be incredibly complex. But yeah, that's kind of where we're at the moment. So
Thanks,
thank you.
Lee.
I'm gonna move on to a hand. I've got Tony Hubbard, and then I'm gonna move back to the chat box and then come back to the hands.
Okay, thanks very much. Can you hear me okay? I've not got a visual image of myself, so I don't know whether I'm showing up on camera. You've not mentioned the Care Quality Commission in all of this, and that its role, particularly monitoring the quality of service delivery by the voluntary sector under the new system. Now, I'm a bit puzzled because the local statutory services still carry the primary responsibility for that qualitative nature of services. So how is that to be divvied up, in a sense, between the two to create that equal partnership that you talked about? Because I don't see that it could be that equal if the local authorities, the statutory services or whatever, still have the primary responsibility for essentially quality. And I'm sorry to be kind of, looking at it a little bit sort of darkly, but I am sort of remembering the days of mixed economy of care. And that was a politically motivated delivery, if I may say so. And that disappeared. This is a very sort of similar package, but with more thought gone into it, I have to say. But the voluntary sector need to have continuity, consistency. If our organisation sets itself up to deliver these services and it fails because for political reasons later, we're left in limbo. So we need to really deal with that issue, very real. We don't have the funds to sort of fall back on something immediately, so can you comment on those sort of issues for me?
Yeah, I mean, the one around quality, I have to say, I don't know enough about the technicalities to give you a full answer to that. I mean, I know that in discussions I've had in the sector, quality has been raised as one of those issues that's sometimes a barrier to joint working and investment, insofar as some people in the statutory sector have been quite risk averse around investing in organisations because they're just not sure about quality and the kind of quality measurement mechanisms that organisations use. So I know that is an issue, and it's one that I've raised with the system, and I think we're just about to have some discussions around. But the technicalities of it, I'm less qualified to comment on, to be honest. I mean, in terms of the other question around and the other question, I think I share that with you. I mean, like you, I mean, I've been around probably for too long in a way, and seen whole raft after raft of partnership initiatives come and go around engaging the sector with other partners, some better than others, and there's always that reservation that this is simply about rearranging deck chairs, or it's simply lots of warm words that don't really evidence themselves in practice. Having said that, I mean, I think in the work that I've been doing so far, so I've been working since April, in the simplest way, what I've been trying to do at the beginning of my work is to try to build understanding and awareness amongst other partners and start to open doors and create opportunities for the sector to be involved in things, which I think we've done quite well. I think the proof of it is going to be how we turn those opportunities into reality. So those last two slides I showed, do things actually change as a result of this work? So do we see plans actually showing a greater engagement to the sector? Do we see priorities and the way things are delivered in a different way that recognise what we have to bring? Do we see the sector more involved in delivery and co-design? I mean, those are the things that are going to be the real proof of the pudding. And as I said at the beginning, because this is a structure that's in development at the moment and it's not actually active, we're not going to know that until the system kicks off and things start happening, whether this is really going to happen or not.
Brilliant. Thank you very much, Wyn. And I'm just very mindful of the time now. So I'm just jumping back to the chat box where I think I left it. And Mark, it's just a small work. I met Mark on Friday, if I believe. Hi, Wyn. Would you be able to clarify if the estimated 6,000 FTE volunteers in Derbyshire County are actual individual posts, or an equivalent number based on a higher number of pro rata workers, for example, 30,000 people volunteering 1 day a week? Thank you.
Yeah, I mean, my recollection of the research, I'm pretty sure it would be a composition of people providing all sorts of volunteer time. So there'd be some people providing a few hours, some full time. It's just amalgamated into a full-time equivalent number.
Brilliant. Thank you very much. Okay, I'm very aware that we're kind of coming to the end of the session now, so I'm just going to take one more question. Maybe I think it was Simon Redding. Have I brought you in yet, Simon?
Hi there. Hi, Wyn. Good to
Hi, Simon.
thanks for that. I just wanted to ask you a quick question, which is we've talked about co-design, and that's that's an excellent approach through the VCSE Alliance. My question is how we're going to integrate continuous improvement and innovation pipelines into this work to ensure that we don't remain static after we do this.
Yeah, another really good question. I mean, I think it's I mean, I'm going to sound a bit like a broken record, but because what we're trying to do here is to set up processes of joint working, I think the first challenge is to make sure that we're part of those co-design processes. And then as those processes start to roll out, we build in things like continuous improvement and evaluation, and to make sure that we're keeping track of what happens. I mean, just to go off on a tangent for a minute, one of the things I'm quite keen the system does is have some evaluation criteria so it can measure at the end of the year as to whether the sector has been effectively involved in this whole process, and we can have some sort of evaluation to say, well, is it working or not? Has this all been warm words but it's actually not led to anything? So each year at the top of the system we evaluate whether that's happening or not, and I guess that's part of that continuous improvement thing, because it's just constantly taking stock of, is this happening? Are we seeing change? What could we do differently? And there are lots of initiatives out there that are starting to happen across partners where I think we can start to look at this. So there are some partnership approaches where the sector has been involved, but we might want to say, well, could more people be involved? You know, have you started to think beyond the usual suspects? Are we starting to think about particular communities and how they might be engaged in this? So I think yes, that is something that will be built in, but it'll be built in as this starts to develop as a process.
Brilliant. Thank you very much, Wyn. Now we've hit we've just gone past the 12 o'clock mark. I'm going to be really cheeky and a terrible chair and just ask if you could take one last question from one hand that we've not come to, I don't think, yet. We've got a hand up from Ruth George.
Thank you. I put the question in the chat, which was about the place alliances. A meeting that I attended regarding the integration of Glossop and into the CCG area and ICS said that the place alliances would be expanded, but certainly the High Peak one does work really well at the moment and integrates really well with the voluntary sector. We're going to be seeing Glossop incorporated as well, so it will be bigger. And I just wondered if it's correct that those place alliances are going to be expanded, because being on a district basis, they do work well with local district and other services.
I have to be honest, I don't know what the current position is on the expansion of place alliances. I mean, I share your view about the High Peak, and I know in relation to Glossop, I mean, Glossop has had some very good VCSE engagement with the health authority that they're leaving. So I think there is a challenge there about how that's pulled together and how some of that is sustained. But I don't actually know. I mean, I'm happy to try and find out and let you know, and I'm sure Lee would be able to do that as well.
Yeah, that's certainly one that we can take away, and I know that we have a separate work stream area. I can pop the link in the chat actually for the Glossop ICS boundary change and any questions around that that we're taking forward and holding separate events for. So we'll feed that one into that, because I think that's a really good one on that one that I'm not sure we've come across yet. So
Lee, could I just very quickly,
yeah,
be a bit cheeky as well? I noticed that Steve Wood had put a message in the chat around social prescribing, and I know the stuff that's been happening in Christ has been really Christ. Some really good stuff happening around that. But just to say, in relation to social prescribing, one of the things that has also been being looked at is whether the patterns of where social prescribing is prescribing to might help to inform investment. So if in a particular area a lot of social prescribing, for example, is going into low-level mental health support services, then could the system invest in the sector in that sort of area to be able to cope with the demand from it? So there are a number of different things being looked at. Not necessarily, you know, it might be you could offer £10 per referral, whatever the figure is, but there might be more effective ways of investing in the sector other than doing it in that sort of way.
Brilliant. Thank you very much. And as ever, there may be one or two questions we've not captured just due to time, but we'll get back to you on those. I've popped a link to the Derbyshire Involvement platform on. There's a Derbyshire Dialogue section on there where you can always ask any questions or suggest future sessions that you may like. And one final bit that I'd just like to let people know that the next Derbyshire Dialogue we've got is on the 30th of March at 11 o'clock, and we'll be covering cancer services. My colleague Lenny is going to post that in the chat now, so that people are able to book on. But as ever, we'll email things around, and please do kind of help spread the word, because it is, without sounding too cheesy, we're all in this together. So thank you very much for everybody that's attended today. We've got a really good number of people that have come. A particular thanks to Win. I thought that presentation was fantastic in what's a very, very tricky thing to explain. So thank you very much, everybody.
I did notice, sorry Lee, I did notice what I forgot to do at the end of the presentation was to put my contact details on. So can they do that through you if people do want to know more about the Alliance or follow anything up? Can they do that through the Derbyshire Dialogue, or is it worth sharing my address?
Yeah, well, I mean, you can pop it in the chat, but I'm also more than happy to circulate it around on email. So, yes, we'll include it in the email, but we'll pop your email address in the chat as well now.
It's on now. Yeah, I'll put it on now. I've just put it in if people want to.
Okay, then, brilliant. Well, thank you very much, everybody. Once again, I'll bring the session to a close now. Apologies, we've overrun slightly, but obviously there's a lot to unpack, and this I'm sure is just going to be one in a series of engagements as things unfold, and hopefully Win will be happy to come back as we're kind of moving forward with this in a future session. Okay, thank you very much, everybody. Lovely to see you all.
Thanks very much.
Cheers. Bye-bye.